Seniors can't sleep through the night. Drink this instead of water for instant deep sleep. Many people over 50 lie in bed at night feeling exhausted but unable to stay asleep. The body feels tired, but the mind keeps waking up. Trips to the bathroom, light sleep, sudden awakenings at 2 or 3 a.m. And by morning, there's no real rest. It's frustrating. It's lonely, and it slowly drains energy, mood, and even health. What if the problem isn't aging, but simply what's in the glass before bedtime? Tonight, that small habit might change everything. Before learning what to drink instead of water, take a moment to subscribe and like this video. This channel is dedicated to helping adults over 50 sleep better, move easier, and feel stronger naturally. Share in the comments. What time do you usually wake up at night? Cinnamon water before bed can gently support stable blood sugar levels during the night, which is one of the hidden reasons many adults over 50 wake up between 2 and 3 a.m. As the body ages, its ability to regulate glucose becomes less efficient. When blood sugar drops too low during sleep, the body releases stress hormones like adrenaline and cortisol to correct it. These hormones increase heart rate, alertness, and brain activity, often pulling a person out of deep sleep without any clear explanation. Some sleep specialists explain that this sudden hormonal response is a common but overlooked cause of nighttime awakenings in older adults. Cinnamon has been studied for its potential role in improving insulin sensitivity and helping cells respond better to glucose. While it is not a medication, several research reviews suggest that cinnamon may help reduce blood sugar fluctuations when used consistently in small amounts. For seniors who experience light, fragmented sleep, even mild stabilization overnight can make a noticeable difference in staying asleep longer. Instead of the body reacting to a sudden glucose dip, the system remains calmer and more balanced. Warmth itself also plays an important role in preparing the body for sleep. A warm drink increases peripheral circulation, allowing blood vessels to gently expand. This process supports the natural drop in core body temperature that signals the brain it is time for deep rest. Many sleep researchers note that the body transitions more smoothly into deeper sleep stages when circulation is steady and relaxed. Warm cinnamon water provides both temperature, comfort, and metabolic support in one simple cup. Muscle tension is another common issue. After age 50, even mild tightness in the legs, feet, or lower back can cause micro-awakenings that interrupt restorative sleep cycles. Cinnamon contains natural compounds that may support circulation, which in turn can help muscles feel less stiff at night. When blood flow improves, oxygen and nutrients reach tissues more effectively, supporting relaxation. While it is not a treatment for chronic pain, some doctors suggest that improving nighttime circulation may reduce subtle discomfort that keeps seniors from staying asleep. Another important factor is bladder sensitivity. Plain water right before bed increases total fluid volume without providing any additional calming effect. Aging bladders tend to signal urgency more quickly, leading to repeated bathroom trips. Warm cinnamon water is typically consumed in a smaller amount and sipped slowly, which may reduce the likelihood of sudden fullness compared to quickly drinking a large glass of cold water. Moderation is key, but many sleep professionals recommend limiting large fluid intake close to bedtime for this reason. The gentle aroma of cinnamon can also influence relaxation. Certain studies on scent and sleep suggest that warm, comforting aromas may reduce mild anxiety and quiet mental restlessness. A calmer nervous system is less likely to trigger alertness in the middle of the night. Combined with steady blood sugar support, this creates a more stable internal environment for sustained sleep. For adults over 50 who struggle with waking in the early hours, warm cinnamon water offers a simple low-risk option to support deeper rest. It works quietly by helping balance glucose levels, encouraging circulation, and promoting warmth without overwhelming the bladder. Small, consistent habits often create meaningful changes in sleep quality over time. Warm milk with a pinch of nutmeg before bed can gently support deeper, more continuous sleep in adults over 50. Warm milk naturally contains tryptophan, an amino acid that plays a role in the production of serotonin and melatonin. Melatonin is the hormone that helps regulate the sleep-wake cycle. As people age, melatonin production often declines, which can lead to lighter sleep and more frequent awakenings. Some sleep researchers explain that even small nutritional support for melatonin pathways may help improve sleep quality in older adults. Tryptophan works by crossing the blood-brain barrier and contributing to serotonin synthesis, which then converts to melatonin in the evening hours. While milk does not act as a sedative, Its gentle biochemical support may encourage the body's natural sleep rhythm. Doctors often note that consistent bedtime habits signal the brain that it is time to wind down. A warm cup of milk can become part of that calming signal, reinforcing the transition from wakefulness to rest. Adding a small pinch of nutmeg may enhance this effect. Nutmeg contains compounds such as myristicin, which have been studied for their mild calming properties. In very small culinary amounts, nutmeg is traditionally used to promote relaxation. Some herbal medicine experts suggest that nutmeg may help quiet nervous system activity when used sparingly. It is important that only a tiny pinch is used, as large amounts are not recommended and can cause unwanted side effects. When used properly, however, nutmeg may complement the soothing qualities of warm milk. Nighttime anxiety and restless thoughts are common concerns after age 50. Changes in hormones, life stress, and lighter sleep architecture can make the brain more sensitive to stimulation at night. When the nervous system remains slightly alert, falling back asleep becomes difficult. The warmth of milk, combined with the subtle calming influence of nutmeg, may help reduce that low-grade alertness. Some doctors explain that warmth itself promotes parasympathetic nervous system activity, which supports relaxation, slower breathing, and a steadier heart rate. Another advantage of warm milk over plain water at bedtime is its potential effect on bladder disturbance. Drinking a large glass of water before sleep increases fluid volume without offering any calming benefit. Aging bladders tend to signal fullness more quickly, leading to multiple nighttime trips to the bathroom. A moderate serving of warm milk, sipped slowly, may feel more satisfying and comforting without encouraging excessive fluid intake. This can support longer stretches of uninterrupted rest. The psychological comfort associated with warm milk also matters. Studies on sleep hygiene suggest that familiar, soothing rituals before bed can condition the brain to prepare for sleep. When the body associates a warm drink with winding down, it may respond more efficiently over time. This gentle conditioning effect can be especially helpful for seniors whose sleep cycles have become fragmented. Warm milk with a pinch of nutmeg is not a cure for chronic insomnia, but it offers simple nutritional and sensory support for better rest. By supporting melatonin production, calming the nervous system, and reducing nighttime bladder irritation compared to plain water, this combination may help older adults experience deeper, steadier sleep in a natural and comforting way. Chamomile tea before bed can gently calm the nervous system and support deeper, more restorative sleep in adults over 50. Chamomile contains natural compounds such as apid, an antioxidant that binds to specific receptors in the brain, linked to relaxation and reduced anxiety. Researchers studying sleep and herbal medicine have found that apigenin may promote mild sedative effects without causing dependency. This makes chamomile a commonly recommended option for older adults who want a natural way to unwind at night. As the body ages, stress hormones like cortisol sometimes remain slightly elevated in the evening. Even small increases in cortisol can keep the brain alert when it should be preparing for rest. Some sleep specialists explain that this low-level stress response contributes to light sleep, frequent awakenings, and difficulty returning to sleep after waking. Chamomile's calming properties may help counterbalance that response by supporting parasympathetic nervous system activity, the branch responsible for rest and recovery. Doctors often emphasize that falling asleep is not only about feeling tired, but also about feeling safe and relaxed. When the nervous system shifts into a calmer state, heart rate slows, breathing becomes steadier, and muscle tension decreases. Chamomile tea, served warm, reinforces that transition. The warmth itself encourages gentle blood vessel dilation and signals comfort to the body. Combined with the herb's biochemical effects, this creates a supportive environment for deeper sleep phases. For adults over 50, sleep architecture naturally changes. Deep sleep stages may become shorter, and awakenings may become more frequent. While chamomile is not a treatment for medical insomnia, some clinical studies suggest it can modestly improve sleep quality, particularly in older populations. Participants in certain trials have reported less nighttime waking and improved overall restfulness after consistent use. Researchers note that while effects are typically mild, they are meaningful for individuals dealing with age-related sleep fragmentation. Another reason chamomile tea may be preferable to plain water at bedtime is that it serves an active purpose beyond hydration. Drinking water alone increases fluid intake, which may lead to nighttime urination without offering any calming benefit. Chamomile, on the other hand, provides gentle relaxation support, while still contributing to hydration in moderate amounts. When consumed in reasonable portions earlier in the evening, It is less likely to overwhelm the bladder compared to large quantities of plain water just before sleep. Some doctors also point out that ritual plays a powerful role in sleep health. Preparing and sipping chamomile tea can become a consistent signal that the day is ending. Over time, the brain begins to associate this habit with winding down. This predictable cue may help quiet mental chatter and ease the transition into sleep. Chamomile tea offers a simple, well-tolerated option for older adults seeking calmer nights. By helping reduce mild anxiety, supporting nervous system balance, and promoting relaxation rather than simply adding fluid volume, it may gently encourage longer, more peaceful sleep. Tart cherry juice in a small amount before bed can support the body's natural sleep cycle, especially in adults over 50. Tart cherries naturally contain melatonin, the hormone responsible for regulating the sleep-wake rhythm. As people age, melatonin production often decreases, leading to lighter sleep and more frequent awakenings. Researchers studying sleep in older adults have observed that reduced melatonin levels are closely linked with difficulty staying asleep through the night. By providing a natural dietary source of melatonin, tart cherry juice may gently reinforce the body's internal clock. Melatonin works by signaling to the brain that it is time to rest. When levels rise in the evening, body temperature drops slightly, alertness decreases, and the transition into deeper sleep stages begins. Some clinical studies have shown that adults who consumed tart cherry juice regularly experienced modest improvements in total sleep time and sleep efficiency. While the effect is not dramatic, sleep specialists note that even small increases in uninterrupted rest can significantly improve energy and mental clarity the following day. In addition to melatonin, tart cherry juice contains antioxidants, known as These compounds help reduce inflammation and oxidative stress in the body. Chronic low-grade inflammation has been associated with disrupted sleep patterns, particularly in older adults. Some doctors explain that when inflammation markers remain elevated, the nervous system may stay slightly activated, making it harder to maintain deep sleep. The antioxidant properties of tart cherries may contribute to a calmer internal environment that supports more stable rest. Circadian rhythm regulation becomes more fragile with age. Many seniors notice they become sleepy earlier in the evening, but wake up in the early morning hours, unable to return to sleep. This shift is often related to changes in melatonin timing and sensitivity. Research suggests that consistent small amounts of tart cherry juice may help reinforce circadian alignment by gently supporting nighttime melatonin levels. Over time, this may encourage longer, more continuous sleep periods. Portion size is important. A small serving, typically a few ounces, is sufficient to provide beneficial compounds without adding excessive sugar or fluid. Some doctors advise choosing unsweetened tart cherry juice to avoid unnecessary spikes in blood sugar, especially for individuals monitoring glucose levels. Consuming it about an hour before bedtime may allow the body to begin absorbing its natural melatonin content as the evening progresses, compared to plain water. Tart cherry juice offers active compounds that directly relate to sleep regulation. Water hydrates but does not influence hormonal balance or circadian signaling. Drinking a large glass of water late at night may also increase the likelihood of waking to urinate. A moderate portion of tart cherry juice provides functional support without significantly increasing fluid volume. Tart cherry juice is not a replacement for medical treatment in cases of severe insomnia, but it offers gentle, researcher-supported benefits by supplying natural melatonin and antioxidants, and by supporting circadian rhythm stability. It may help adults over 50 fall asleep more easily and remain asleep longer in a natural, supportive way. A magnesium-infused warm drink before bed can support muscle relaxation and nervous system balance in adults over 50. Magnesium is an essential mineral involved in more than 3 biochemical reactions in the body, many of which directly influence sleep quality. It helps regulate neurotransmitters that calm the brain and supports the production of gamma-aminobutyric acid, or GABA, a chemical messenger that promotes relaxation. When magnesium levels are adequate, the body is better able to shift from alertness into restful sleep. Many older adults are mildly deficient in magnesium. Without realizing it, changes in digestion, medication use, and reduced dietary intake can all lower magnesium levels over time. Some doctors report that low magnesium may contribute to nighttime leg cramps, muscle twitching, and a general sense of physical restlessness. These symptoms often appear just as the body is trying to fall asleep, leading to repeated awakenings or difficulty staying asleep. Addressing this deficiency gently may help reduce these disturbances. Magnesium also plays a role in regulating the stress response. It influences the hypothalamic pituitarial axis, which controls cortisol release. Elevated cortisol in the evening can interfere with deep sleep and cause early morning awakenings. Research suggests that adequate magnesium intake may help maintain healthier cortisol patterns, allowing the body to settle more naturally at night. When the nervous system is less reactive, heart rate slows, and muscles release tension more easily. A warm magnesium drink offers both biochemical and sensory support. The warmth itself promotes relaxation by encouraging mild vasodilation, improving circulation to the extremities. Improved circulation may reduce sensations of tightness or discomfort in the legs and feet. When muscles feel calmer and less tense, the body is less likely to trigger small movements or awakenings during the night. Sleep specialists often emphasize that even minor muscle contractions can fragment sleep. Architecture in older adults. Some clinical studies have examined magnesium supplementation in older populations with insomnia. Participants in certain trials showed improvements in sleep time, sleep efficiency, and early morning awakenings when magnesium levels were restored. While results vary, researchers generally agree that magnesium deficiency is linked to poorer sleep quality. Correcting mild deficiency through a gentle nighttime drink may provide gradual but meaningful benefits. Compared to plain water before bed, a magnesium-infused drink serves a functional purpose beyond hydration. Drinking a large amount of water late in the evening increases bladder pressure without offering any calming effect. Aging bladders tend to be more sensitive, and frequent nighttime urination disrupts deep sleep cycles. A moderate serving of a warm magnesium beverage, taken in appropriate amounts, may support relaxation, without encouraging excessive fluid intake. That it is important that magnesium supplementation be used responsibly. Some doctors advise choosing forms such as magnesium glycinate or citrate in moderate doses, as they are generally better tolerated. Excessive amounts can cause digestive discomfort, so balance is essential. When used appropriately, however, magnesium can gently assist the body's natural relaxation processes. A magnesium-infused warm drink offers targeted support for muscle calmness, nerve stability, and hormonal balance. By reducing restlessness, easing cramps, and helping the nervous system settle, it may allow adults over 50 to experience longer, more restorative sleep without the repeated awakenings often caused by late-night water intake. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.